So if you had, based on your experience, and throw this out to both of you, but in your experience when someone's at that point, and for those of people who are either watching or listening to this, and they had someone in their life that said, hey, I don't want to live anymore, or, and I it's terrible to say lucky enough to hear that, because sometimes we don't hear it, right? And it happens like in the case of Joe. But what would be your advice in that type of situation? And maybe, dovetail into a little bit talking about Oscar and talking about Care to Prevent Fail and some of those things that you're doing proactively to get resources and information out there. But let's start with maybe your advice to people who have someone in their life, whether it's a family member or a coworker or anybody like that, that is presented with this type of situation.
If they don't tell you, ask. You have to say it. You have to ask, because asking someone if they're planning on ending their life doesn't give them the idea or permission to end their life. And people are afraid to say the word suicide because they don't want to put it on the table. They're afraid to ask someone, are you considering suicide? Because that will make them. That's not true. What it will do is it will make someone feel heard. And we have to be able to ask that question. We have to be able to do that. So if somebody really has someone in their life that they're really concerned about, they need to ask them right away. And they need to get them to some kind of help. And there's different tools for doing that, certainly. There's different trainings people can get. They're all free. There's something called Question, Persuade, Refer, QPR. CPR is for the heart, QPR is for the mind. And it's to make sure that someone stays alive long enough to get to help. So there's different tools that we have, but being able to say it and being able to address it in real time. So those are two different things. Right. And to be able to address it in real time is a very powerful thing, indeed.
Thank you for that. That's
it's important to tackle that myth that if you ask about it, you're putting the idea in their head.
And I think that's why I asked. You know what I mean? I think that probably came from a place of, gosh, I wouldn't want to. If someone was really withdrawn or said the words or just seemed like really in a ton of despair, like, gosh, but I can't ask them. Are they thinking about something like that?
Yes, and that's where the word care comes in that we're going to talk about later, just to segue into it. So basically, you have to listen with compassion. That someone's in a lot of pain if that's what they're contemplating, that they're really hurt. So you have to be compassionate. You have to accept where they're at. One of the worst things you can do is argue with someone. And people will do that because they're trying to convince them not to do something. This isn't a time for polemics, to engage in a debate. This is why you should be alive. This is why people don't want to hear that at that moment. And the reason is they feel they've disappointed people. They're not going to succeed at what they're doing. They're suffering too much. They can't go on. So rather than argue, you have to, the A in care, you have to accept that's where they're at. And when you accept that's where they're at, then you have to refer. And as a mental health person, I may have to call myself the psychiatric emergency response team. I'm doing something professionally called a lethality assessment. A lethality assessment means I'm saying, I've had people who tell me, I am going to the Swiss Alps, walk into the snow, and freeze to death, but they don't have the money to buy a ticket. They're going to save up the money to go to the Swiss Alps. So they have a plan which is not very reasonable. But if someone tells me, I have a gun, it's in my car, I'm going to go blow out my brains right now, it's imminent, which is a word that we use in lethality, and I call in the cavalry. I call in the psychiatric emergency response team while they're in session. They're not, we're expanding it, but they're not available from about midnight to about 7 a.m. So there's a period of time when they're not available, but I call them up. Or, as you'll hear in a moment, I could use the Oscar app to find what's open and where to send someone. So I refer someone carefully, and then I also look to empower the part of them that has reached out to me and potentially wants to live. And I empower that by finding that small tincture or droplet of faith, that small sense that is now flickering, that's almost blown out, of maybe things could get better, and I empower that bit of hope to help someone get to the next phase where they're getting the necessary support. So at that moment, I care, I bring compassion, acceptance, I refer appropriately, and I empower the part of them that wants to live.